people one generation ahead of me lost all their friends. And so you don't just move on from an experience like that.
And watching these people get sick and die really made me upset. We weren't told how to support them taking care of themselves. They weren't told how to take care of themselves. So I took it upon myself to figure out what it was and talk to them about it.
You know, they always said if you want to be the change in the world, look in the mirror. And in this world where we need technological advances in terms of our medicines, we need a lot of people who would say, I'm putting my hand up to see where this is going to be.
Los primeros años de la epidemia del SIDA en el país fueron muy difíciles porque teníamos pocos recursos.
Growing up, here's some of my first experiences with people dying, involved people passing from HIV or AIDS.
Como médico de la comunidad gay, me llamaban para el certificado de muerte. Si yo escribía VIH, no le daban los trámites de defunción.
Pienso que en esos momentos el Estado, el Ministerio de Salud, no tenía idea de que era una pandemia.
Fueron años muy terribles.
My first partner died of AIDS while taking ACT. Why were they giving these meds? This is a cancer med. Like, let's figure all of this out. So I got involved with ACT UP.
So there's a family friend, beautiful, her smile, you would swear that it smells like sunshine, and quite a beautiful person. And at a later stage in her life, she just stopped taking because she was tired. She said she was just tired of taking treatment and she just wants to die. And it's a sad moment, it's a somber moment for my life. And with that, I've always been keen on knowing when can we find this new vaccine.
And so it felt important to me to be part of sort of this cutting edge organization because you get to hear about what's happening with vaccine research and everything on the cutting edge of prevention. And it really inspires hope, and you can bring that back to your wider community. It's really powerful.
So being a volunteer has made sure that I'm also part of a community whereby I'm able to tell people who are skeptical as me before in wanting to join studies, or they've been hearing this and that about studies. And now when they see someone they actually know, someone they actually trusted within the community, it also makes it quite better for them to easily join or become volunteers.
HIV is so interesting because it touches communities in different ways. The stigma is really real still. There's a lot of under-education and communities that don't perceive themselves to be at risk.
I've always believed and still believe till this day that we live in a global community.
I belong to a bunch of communities, and each one have their own overlapping issues in regards to HIV.
A CAB member is very basically kind of this go-between between a public and sort of pseudo-academic group that is doing research and staying on top of the top advances in this field of HIV prevention research. And the CAB member can take that information and go both ways between the community, sort of what are the community concerns, what's acceptable to the community, what does the community want.
Our work is collectively making sure that there is a relationship between the research site and the community. And the community knows what the research site is all about, what type of studies are there, and then that's the same information relayed to the constituencies that we also represent. And just building that relationship of trust, because if there's no trust, then nothing's gonna happen on the research part of it.
And also the other way, bringing the information about, there is hope. We are making really amazing advances in the field of HIV prevention, and that's not always widely known in general communities at risk.
That's when, if you can't talk to the scientist next to you, there's a community person that you can talk to.
And also just making sure that communities know about these things and become excited, and just know that if you have HIV, it's not the end of your life. It's just the beginning of a beautiful new journey, but with extra things that you just need to take into consideration. Being a volunteer in a study is a very big and interesting thing.
You can offer them this warmest possible referral and actually talk through their concerns.
Hey, do you have any questions? Right, this is difficult for everybody. It's difficult for the scientists. That's why they're doing the study around it. You know what I mean? They think it's a great idea. What do you think?
And then asking my questions, all the questions that I wanted to ask, and they were answered in a professional manner. And then that's when I knew that I would really love to participate in being one of their studies.
I can go to that person, if it's someone that I know, and say, my experience with this entire research team, top to bottom, has been folks that are ethical, folks that really want to end the epidemic, and folks that care about your concerns. So if there's something that in a trial design makes you feel like a subject and not like an active participant, we want to know that, and we can talk about it, and it might end up changing some of the enrolling criteria.
What I usually tell people who tell me that I'm a guinea pig, as I'm proud to be one of those guinea pigs. So I would say to them, take one step, look in the mirror, and then just think about someone you've lost to a virus, to a influenza and what's or not, and think about what would you have done if you're in their shoes.
And it has to start, you know what I mean? Like the idea of starting community education has to start someplace. And if we can pass that message on or start that process, let's do it.
My hope for the next decade in HIV prevention research is that we make really big gains in the disparities that we see. We have some life-changing tools.
I still see and experience and feel a lot of health disparities, particularly around access, particularly when I think about, the life-saving and lifestyle-saving access to things like PrEP and PEP.
It is a call to action for public health. And so that's my hope for the next decade, that we get much, much better at distributing these prevention tools to the people that need it most. And ending HIV would give people, a lot more freedom to express themselves, be in their sexuality, be in their lived experience with, I think, less fear. I think the clear impact of that 25 years of HVTN work is really smart, really capable people united in a common cause of we need to get this research is so important to so many people that we can't afford to fumble. So we need to be transparent and efficient about our resources and what we're doing.
I'm part of the difference this world is needing. Because if there's no one like me out there, then we'd never had vaccines for flu, we'd never had vaccines for this and that. And someone wanting and willing to say, try this with me, is someone willing to take a step further.
I'm proud to be part of the VTN because there is such a transparency to the process that the community engagement folks are accessible folks. There is not a presumption that they have all the answer, that they're actually looking for me and the other CAP members to have answers to support the work that they're doing, right? And so it is meaning-making, which is the highest level of being connected to something.